Again, hello to the people that are getting here now. We're gonna give a few more minutes for everyone to get here. We have, oh no, we have a few only. Damn, let me check what's up. Okay, so a couple of minutes and we're gonna start, okay? Hello to the people that are getting in now. Again, we're gonna just give a couple of more minutes for everyone to get here, and we're gonna start, okay? Again, we are just gonna give, 1 or 2 more minutes for other people to get here, and if not, we're gonna start. You got 8. You're supposed to be almost 20. 10. What is guy here? Andrea. Hello, Andrea. Okay. Hello, hello. 1 or 2 more minutes. Okay, hello again, people. Let's see who else got here. I've been trying to see if there's anyone that's missing for whatever reason. I've gotten no messages, and I contacted most of the ones that aren't here. I'm gonna back again. So we had, here we go. We have Frank Jr. We have Frank Jr. in the house. We have, hey, oh my God. There you go. Williams. Hey, Michael. Jackson, Newton. Good, good, good. Okay, now it looks like now I was getting here. Excellent. Now we're doing better. Frank Senior. Okay, now it looks a lot better. Okay, so let's start. Let's not waste more of your time. Hello again, everyone. Thank you for being here and being on time. Please let me know if you can see my screen. Yes. Thank you. Okay, so now we got to the point that we are going to start talking about the coding aspect of this. We're going to talk about the ICD-10, a little bit of the history of it, a little bit of what it is, how it works, and what are the ways that you're gonna use it. Again, for the ones that went and picked up their books, they're gonna give you a book and uh, a workbook, and then I imagine next week or later you will be getting the coding books. Those coding books are gonna be the most necessary for the exam. But as of right now, we can try to understand what the books are, what the books are going to do, what they're gonna explain, and what are the things that you're gonna use in order to get it right. So, like always, I like to go with numbers before numbers, words, and we're gonna use the definition. So ICD-10 CM stands for I for international, C for classification, D for disease, international classification of disease. This means that the codes that we're gonna use, we're not gonna be the only ones that will use them. We're gonna be using them all over the world. And that's really important because the same headache that you get here, the same broken leg that you get here is going to be the same code that we're going to use everywhere in the world. So it will bring the globalization of healthcare or at least health records to a point that is going to be really, really, you know, big in the sense of I can go anywhere, I can travel anywhere, and then get my information either with me or at least anything that happens could be checked by the using the codes. And again, super simple way of hello, making sure that we have the information for everyone that is using it around the world. Now, the number 10 means that is a 10th revision, so that means that we've had 10 books already. So we're using the books or the revisions of the book to name them. They tend to last for around 10 years ish. Even though ICD-9, the one that was before, lasted for like 30 years here in the US. So we know that already they're working and talking about what new things are gonna have or appear for maybe the ICD-11. But it's been a couple of years now, and we're still using this 10. The last part is the CM. CM is the clinical modifications. That last part is we are the only ones in the world that will use it. So CM is the clinical modifications to move the kind of international aspect of it to and zone it to the US. So one of the ways that I can make you remind or remember that will be that CMS, the Center for Medicare and Medicare Services. So kind of the ICD of the CMS is ICD-10-CM. That's one way of looking at it, and it usually works. So when we talk about ICD-10, we talk about international, we talk about everyone. When we talk about ICD-10-CM, we're talking strictly the US. So we're gonna talk about the differences between hopefully the differences between 9 and 10 just for as a matter of historic purposes, not that you need to know anything about it. And then we're gonna talk about the ICD-10-CM, the PCS, and we're gonna show you how to code, show you how to get things. What are the guidelines that we're gonna use? How to look for a code, simple as that. And that's basically saying how the book is structured. So let's see. The first thing that we're going to talk about is that the ICD-10 CM, it's a set of codes, and they're going to be for all diagnosis, regardless of healthcare setting. So I do not like the word diagnosis here that much, because it's not only diagnosis, it's conditions. And it's not only conditions, it's states of a condition. And kind of to start with making things complicated, I'll ask the females, the females in the group that had kids, if they think that that diagnosed or it's a sickness to be pregnant. So it is a diagnosis. I want you to understand, we're not saying only things that are sick. So diagnosis. Diagnosis being pregnant. So being pregnant, being 5 months pregnant, it's a diagnosis. Is it considered a disease? Well, no. But ICD, the D in ICD stands for disease, not for diagnosis. So we're not saying it is a condition. It is a condition or a state. You want to do it better. But the classification is for disease, International Classification of Disease. So just don't be confused that the word the D is for disease. Just remember that it is any of the different diagnoses that you can have. So even though it's a diagnosis, the diagnosis could be a diagnosis of disease. It might not be. Okay. For example, and I keep going back to healthy baby visit. Healthy baby visit has a code, and it will have a ICD-10-CM code for healthy baby. That is not a diagnosis. It is, but it's not a disease. It's not a condition. It's not nothing. It's just saying, hey, because I need the some type of ICD-10 code for this, then you diagnose the patient with healthy baby. So really interesting how that one works. It is completely again specific to diagnosis, conditions, and settings in different conditions, and it's going to be the same for physicians' offices, outpatient care, clinics, home health, hospice, hospitals. Everyone is going to use the same thing, at least in the US. Okay, in some other places they do that too. But remember, every single thing that we get from the ICD is going to be used for every bill or every claim that we submit. Now, that's ICD CM. So again, I just said it's used in hospitals, okay? And I also said here outpatient care. So I want you to remember that outpatient and inpatient are two different things. Both of them can happen at the hospital. So when we say ICD-10, we mean everything. CM means everywhere, including hospitals, and ICD PCS is going to be for hospitals, but now for inpatient procedures only. So now we start seeing a little bit of the difference between ICD-10 CM and ICD-10 PCS. Okay, cool. Now let's move to CPT. CPT and HCPCS are codes for procedures and services. So CPT for procedures, HCPCS for services. Okay, these are going to be matched to the ICD, but in this chapter that we're talking about only diagnosis, only about what the patient has. So what are we doing to the patient? It's the CPT that is going to be, or we're going to talk about that in the next chapter. So as of right now, all of this from the bottom, we are not going to use now. CPT and HCPCS are for procedures, are the things that we're going to do to the patient. The top part, the ICD, is the one that has to do with what the patient has. What is the condition of that patient? What is the state of that patient? What is the diagnosis? What is the disease that that patient has? And that's what we're gonna do, or do at least in this chapter. Now, remember, I'm gonna do it one more time.
Yeah.
Hospitals have outpatient and inpatients. Really important when we start doing this. So don't forget, when we say inpatient, it's admission to a hospital. Admission. You stay in the hospital for more than 24 hours. You are admitted to the hospital. You cannot leave. I mean, you can, but if it's a baby, the baby cannot leave until we discharge the baby. Okay, it is a state of being in the hospital. Now, if you go to the hospital as ER, you go to the ER and then you leave. That is not an admission, but it wasn't the hospital. You can get surgery in the hospital, same day surgery, outpatient clinics, outpatient surgery centers. You go in, do your thing, and then you're out by the end of the day. That is not, it's, even though it's in the hospital, it's not inpatient. Remember that. Now, a little bit of the history here. We had ICD 9 and CPT and HCPCS, and then it changed back in around 2014. It was, it had to. We have ICD 9 CM before, and now we have ICD 10 CM and PCS. And then for inpatient and for outpatient, we have ICD 9 CM, CPT levels, CPT and HCPCS level 2. It's kind of the same thing. So hospitals and small clinics and doctors' offices, all of them have to, get to the ICD-10. So there's no other code that we use for diagnosis. It's ICD-10. So if you see ICD-9 in whatever thing you're reading, it is a historical thing. It's not something that we use anymore. We do not use them since 2014. So around 14, it became law probably in 2012, and then, or even before than that. But they kept pushing it, and then it it stayed around for like a year or 2 years. So around 2014, it became law. You cannot use ICD 10 anymore. So for a little bit, we have some mappings, some things to go from ICD 9 to ICD 10. So there was books and there were kind of tricks and things that we could use. But the problem is that most of the ICD 9 codes were not matched properly to an ICD 10 code. They were not a one-to-one code. So for a little bit, we had the mappings or the general equivalent mappings. We don't see them anymore. It's been probably like 10 years since we've been using the ICD-10. So it stayed, ICD-9 stayed for around 30 some years. So it started like maybe around the early 80s or late 70s, and we kept it all the way until 2012 ish. So again, that's just history. We're not gonna think about uh, ICD-9 anymore. Let's go to ICD-10. Okay. So question that's gonna be that could be on your certification exam is, what is the ICD-10? Okay, and what is it? What is it for? So remember, the ICD, this case, the ICD-10, it is the International Classification of Disease. It's published by the World Health Organization. They meet in Geneva. I think they meet every year, but they update or change the ICD-10 every time they meet. Usually they don't change a lot. And then it has classifications for mortality. Okay, so basically is if someone dies, you have to use an ICD-10 to certify that the patient died. What was the cause of death? What are you going to uh, put in a death certificate? Okay. Now in the US, we decided, you know what, we can also use it for disease. So mortality is death, morbidity is disease. We could have a word that could say comorbidity, and that means that you have a disease, another disease at the same time, so comorbidity. So in the US, we use uh, we modify the ICD-10 so we can actually use it in a clinical setting for morbidity. And then the PCS, again, created by, remember, everything that has to do with healthcare has to do with CMS, with Medicare. So Medicare created that one for inpatient hospital patients only. So to give you an example, if you submit a code that is inpatient hospital setting only, and you submit it in a doctor's office, those two things don't match, no payment. Okay, so you need to make sure that you know what the codes are for, when to use them properly. So just as a matter of reminding you, international classification of disease, we've had 10 books already. This is number 10. In the US, we use ICD-10-CM. This is for outpatient setting, and ICD-10-PCS for hospital inpatient setting. But remember, it's not that much of a hospital, it's an inpatient that matters here. So why do you need to get a code, and why do you need to get it properly? If you get the correct one, you will get paid properly. So one of the ways that we figure out which one it's the correct one, then they will always go to to a specific process in order to say it. So if you see that the documentation is not working properly, then you activate the physician query process. It's just documentation, and who's going to take over. And then everyone's going to say, hey, this code is not working properly. I need documentation on when and how to use this code. Again, who are you going to ask that for? It's going to be CMS or Medicare, right? So again, most of the time you know the codes, but you could get a new code, or you can get something that is denied. They're asking for another code, and you have to figure out how to get it. So the easiest way to do that is through computers. The computer is going to assist in the coding process. So again, for all of you that get scared because we have 75,000 codes in the ITD, and you go like, wait, what? Do I need to memorize all those codes? No, a computer is going to do that. Okay, so you have a computer. The computer is gonna have the information for the patient, the information on everything. It's gonna have, so that's a computer. It's gonna have software that is going to it's what we call the computer assisted coding, and that software is going to start getting the options for the codes that you can get. So ICD, CPT, HCPCS, whatever it is. Then you guys are going to select the right one based on what you know about the codes, what you know about the patient, the information on reimbursement, and then that is going to create the first part of the process. And then we are going to say, hey, doctors, providers, this code you can use. And then you can go to the financial and say, hey, this is the code that the doctor used. please put it in the bill and submit. What parts of what bills or forms are you going to use? CMS 1500 claim form or the UB04 claim. UB04 Universal Billing Form for 2004 for inpatient hospital patients, and the CMS 1500 form for outpatients. Doesn't really matter where they are. It could be a hospital, it could be a doctor's office. So if you think, oh my God, this is too many, and you probably you haven't thought about it that much because you haven't gotten the book, I can guarantee when you get the 3 books that you're missing, you're gonna say like that is a lot. Imagine just books that have, for example, I have an old version of the ICD book here, and it has over 1,700 pages and super tiny print. Okay, like it's so massive and so big that there's no way. But the computer's gonna help you. The computer's gonna help you locate the code, get the whatever proper code goes, and with what. So it's not only now those things that you're just remembering from class or from using them. The computer will help you out, and it will be a super easy process. Now, we mentioned this before, and like I said before, we are going to keep seeing these things over and over again. So let's talk about medical necessity again. Medical necessity is the process of determining if a procedure or a treatment or a service or piece of equipment is medically necessary for the patient. So it needs to determine that, and it has to be certified by someone. So you determine it by checking the patient, by looking at the labs, by your knowledge as an individual, right? Then a doctor or someone determines that, but also puts it in writing. And when you put it in writing, you are not only doing a determination, you are proving and putting your name to it, and you're saying, "Hey, this is medical necessary, and I'm providing the documentation." When you have those two things, then the process can start, or the service could be given. So now that patient that is given that service will have to pay for it. Excellent. Now, in order to do that, the test, service, or procedure uh, has to be medically necessary, and it could be determined and approved and done by the doctor, but it has to be now also be found medically necessary by Medicare for it to get paid. If you find that that Medicare says this procedure is unnecessary, or Medicare says that they're not going to pay for it, basically that's what it's saying, you have to have the patient sign what we call an advanced beneficiary notice. Okay, so we call it beneficiary notice or advanced beneficiary notice. It means that I'm telling the patient in advance that Medicare will not pay for those services. And at that point, if the patient still wants to go ahead with the procedure, then they need to know that you as a biller can bill them directly. So it is a medical necessity is a determination and a certification by a doctor, a medical professional, that a service or procedure is medically necessary for whatever illness they have. That is not enough. It has to be medically necessary by or approved, certified by Medicare. If Medicare says that it's medically unnecessary, then that patient will have to pay for that procedure. So in your exam, 100% of the time, I want you to think about it, write it down, and memorize it. They're going to ask you about this. And they're going to do a little story. And they're going to say, Mr. Smith got a service that was deemed medically unnecessary by Medicare. He signed an advanced beneficiary notice. and the procedure was done, who will get the bill or who will pay for the procedure? And if it was medically unnecessary by Medicare and the patient signed the advance beneficiary notice, the correct answer is you bill the patient. The patient gets a bill. The patient has to pay. But it's your responsibility to have the patient sign the advance beneficiary notice. If the patient did not sign the advance beneficiary notice, you cannot charge the patient, you cannot charge Medicare, you lost that money. So medical necessity, again, it is a process of determination, certification by a medical professional that that process, that procedure, that service is necessary. Well, that doesn't mean that it's going to be paid by Medicare or by the insurance company. In the case of Medicare, Medicare can say no. If the patient would still want to go ahead with the procedure, then they have to sign an advance beneficiary notice. And the whole name is advance beneficiary notice of non-coverage or no payment. And if they sign that, they will get the bill. If you, as a medical coder, a biller, you do not have the patient sign that, the provider lost its ability to bill for that service. So, advance beneficiary notice of non-coverage, of non-payment, has to be signed before. That's why it says advance. It has to be signed in advance. You cannot sign it after the fact. Usually, you try to be sneaky and you sign it after the fact. And again, Medicare will not allow it. Are we clear with this? Medical necessity. We mentioned it a few times in the last couple of days. Questions? Are the examples clear? Are you still here, people? What is this? Are you sleeping, eating? What is this? What is this? Okay, I'm gonna do another and let's going back to the same example that I always give. Is that the patient that needs a wheelchair? Okay, if I say as a doctor the patient needs a wheelchair, and I say because the patient broke his leg or her leg, okay, I can say as a doctor, yes, this is medically necessary, but Medicare says no. For a patient that broke their leg, they'll get a walker or crutches. We're not going to pay for a wheelchair. I tell the patient, hey, Medicare will not pay for this wheelchair. Do you want the wheelchair? Do you understand that if I give you a wheelchair, you have to pay for it? The patient says yes, signs the paper of the advance beneficiary notice of non-payment or non-coverage, and then you give them the wheelchair, and then because you know it's not gonna get paid, you bill the patient. If there's no such document signed, you cannot bill the patient, you cannot bill Medicare, and you already gave the wheelchair to the patient. You cannot bill for that wheelchair. You just lost your ability to do that. And that could be anything. Surgeries, usually surgeries. You have to ask first, Medicare, are you gonna pay for this? Usually Medicare pays, but they could maybe not. If they say no, in advance, you have to have them sign this in order to charge the patient. So again, whenever you see advanced beneficiary notice of non-coverage, think about it has to be signed and the patient is responsible for payment. If it's not signed, you lost the money. For sure, you're gonna remember me on the day of the exam. That question is gonna be there for sure. It's the type of question that exam makers love to put there. It's a really important one. In the CMS 1500 form, in the bottom, there's a little box that you have to check. Did the patient sign the advanced beneficiary notice of non-coverage? And that's usually when you remember, oh my God, we didn't sign it. and then you scramble and try to get the patient before you send the thing. So in your daily life as a biller and coder, you're gonna see this every day, and it's kind of the same thing as asking for pre-authorization in a private insurance. The same thing. You ask for pre-authorization, they say no, then you say, "Hey, patient, you want to still do it? You want to do it? It's gonna be out of pocket." Kind of the same principle, but it has a fancier name in with Medicare. Now, we're gonna go through all these things one by one, but a few that I wanna go back and we talk about abbreviations. You need to know the abbreviations that they're used in the book, the punctuations, the how many things are gonna be in tables, specifically cancer, neoplasm. So anything that has to do with cancer is gonna be on a table. Super simple to understand. There's some notes that you need to read for each and every single uh, code, and they will say it includes this and this and this and this. Also might say it excludes this and this and this and this. So if what you're trying to code is included in the notes, then yes. If it's excluded, then usually tells you excludes this and this and this, go to this other code. Kind of the same thing for inclusions terms. Now, specified, other, unspecified, those are codes that we tend to not use. To give you an example, you have a broken leg, or the patient has a broken leg. What leg it is? What leg is broken? Do you know, or you don't know? You might say, well, of course we know. It's the left or the right. If you don't know, then you have to put unspecified. How don't you know? Like, think about it. How would you not know what the actual broken leg is? So that's kind of a problem that we have with unspecified. Unspecified, means nothing. It means that you don't know which one. How? Let's say you have, I don't know, impactor cerumen in your eardrum. So you have out of earwax in your ear, and we're gonna clean one of the ears. You cannot put it unspecified ear because the insurance company will say, like, how don't you know if it's left or right? Simple as that. So unspecified, other, we try to get as far away as we can from them. Okay, let's see. We have more people here. I think we do. Hello to the people that haven't said hello yet. Let's see who we have here. We have hello, Kamika, I already saw. We have missing Parker. Nope, Parker is there. Hello, Parker. I haven't seen you. And then who are we missing? It's like, her name is the Karen. Yeah, he's missing Karen. Yeah, good. It's good. I like it. Okay. Another things that we're gonna talk about is etiology. That is what is causing it. So if you have, for example, have a condition that is caused by something else, then you have to be careful when you use those codes. For example, I could say the patient has hypertension. Okay, hypertension caused by pregnancy, for example. So you will use the code for pregnancy complicated with hypertension, not the hypertension by itself and the pregnancy by itself. So that's something that we're gonna start talking about a lot. That's why we're gonna have and, due to, with, as an example that I just said, pregnancy with hypertension, gestational diabetes, that is being pregnant and then have diabetes, different from being pregnant and suffering from diabetes from before. And then a bunch of cross-reference things like C also, That's really helpful to get the actual proper code. Now you'll see that you have indentations, you have bold, you have italics. So at the beginning, it's a lot of things. So what I want you to start thinking about is how these things are used. I'm gonna show you the list of the codes in a little bit, and you will see again that everything is again indented, in bold, in italics, and you hopefully you understand it really fast. Tabular list so is the tables or the things that are in the with all the information, or you can have the actual numbers in a list. One of the things that you need to know is that many words mean kind of the same thing. So eponyms is what you use for disease or syndrome, name for a person. So it could be an actual name of someone. Uh, we have alphabetical sequence for the main terms in the index. So the index will look like any other index in any other book, in any other like a dictionary. It's going to be a list of all the codes or the names of the codes, not the actual codes, in alphabetical order. So if you're looking for hypertension, then you go look through the index and you look at the H and you look to hypertension, and then it will tell you what code to go to, and then you will go uh, to the actual chapter, and then you look for that. It will tell you what page and everything. So it's kind of simple to do it that way, but it takes a lot of time. So when you're doing the exam, if you do not know it, how to get it, any other way, then look for whatever code they're asking you in words in the index. Now it will take forever. So that's the only thing that I'm saying. You have terms and then you have subterms. So you have the term and below it you have the subterm, and it's really simple to use as long as you practice a little bit. And then the tabular list is just both the name and the description. So we're gonna have a bunch of abbreviations. We have a few here. The one of the two most common ones, not specified elsewhere or not elsewhere specified or classifiable. So not elsewhere classifiable. NEC. Not otherwise specified. So there's gonna be a bunch of little things that you need to understand. If I go super specific, good, but it might say that I don't have it anywhere else. So those little things you need to start looking into. So what does it mean? It means that codes are assigned when some information is needed, but a more specific code is not or cannot be located. So again, going back to the example, we have a patient that is pregnant. Okay, so pregnancy, you need to know a few things. First, if it's one baby, if it's two babies, if it's the first trimester, the second trimester, if we have complications, if we have something else, we have things from before, a bunch of things. And these two abbreviations are gonna help to get it to the most specific form or code that you can. We have a bunch of punctuation. They're gonna ask you in the exam for a few of them. I'll show you in the book what they are. Actually, when I'm showing you in the uh, in the page, I'll show you how they're used. But column, parentheses, brackets, everything will be included in it. So again, it's easy to look at. I see here that we are mentioning modifiers again. Modifiers, remember, it's a two-digit alphanumeric code that we use after CPTs. So you might need something, and it will be in the book. Will actually tell you. Usually, the brackets are gonna show synonyms, abbreviations, alternative wording, or explanatory phrases. So you're looking for a code. Uh, you go to the index, you back to the code, and then you have to read whatever's in the bracket to see if whatever you're looking is exactly there or is excluded from the one that you just got. Now this next one is tables. Most of the tables are gonna be neoplasms. Neoplasms is cancer, not necessarily cancer, but new growth. That's neoplasm, new growth. And not all cancers are malignant. So, or not all neoplasms are cancer or malignant. So we have benign tumors, but all the tumors are gonna be cancer. So the way that we're gonna put them all together is to see if they are part of a specific group, and then if they are benign, if they are carcinoma in situ, if they are a full-blown cancer, whatever it is. So all that information is gonna be there. So it's neoplasms or cancers are simple to get. Basically, tumors that are gonna be either malignant primary, malignant secondary, malignant in situ. They could be benign, or we do not know still what they are. We do not know their nature. So there's 4 or 5 descriptions for each tumor of each place, or each organ might have different ones. Example, breast cancer has this many different types of breast cancer, and each one will have all those things: malignant, primary, secondary, in situ, benign. So we could put it all on a table, and it's easier to understand. Table of drugs and chemicals. So if there's anything medicinal, chemical, biological substances that are going to result in poisoning or adverse effects, they are going to be included. So if you think about it, every single medication that you take could have side effects, or every medication will have side effects, or could potentially have side effects. So every single medication is going to be in the table. It's going to be in alphabetical order, and then it's going to say, you know, poisoning because of this medication, and that will be your diagnosis. Now, you start thinking why or how that happened. So if I take a medication because it's a medication that I'm supposed to take, and I took the right dose, and it gave me an adverse effect, then it's going to be a specific code. So poisoning, regular normal use. But let's say I took too much, then you have an intoxication of it. That's another code. Let's say I tried to commit suicide and took a bunch of pills, then it's not only an intoxication or a poisoning, it's with the intent of self-harm. That's another thing. What if someone push a bunch of pills down my throat? That is now someone try to harm you. So every single thing will have a different code. So all those substances, all those drugs and chemicals are gonna be in a table in order to get them with really fast access. Now remember, we have includes, excludes, and inclusion terms. So includes nodes, they're gonna be after the code. In the bottom of it, you will say code on top, and then includes this. So it's to define, clarify, and provide examples of content of a code category. Excludes one, it means that it's the code that you're looking for is not there. Okay, so if you look for something and you get to the code, and then you look down and it says excludes, and exactly what you're looking for, it's excluded, then that's not the code that you're gonna use. So you will have to go to, and it will tell you like go and see something else, and then you follow that. Excludes two, it is the same thing, but you cannot have all of the conditions at the same time. The best example is pregnancy. Pregnancy with diabetes or gestational diabetes. There's two different things. So to give you the complete example, if a patient is a diabetic and they get pregnant, that is not gestational diabetes. That is pregnancy with pre-existing diabetes. If the patient was not diabetic, got pregnant, and became diabetic, that is gestational diabetes. The treatment is kind of the same for both. The patient is treated the same for both, but for the purposes of having the correct code, then those two codes are going to be different. So you have to be careful with that. Let's say the patient had normal blood pressure uh, before she got pregnant, and then she gets pregnant. Then regular hypertension with with pregnancy will not cut it. It has to be um, pregnancy complicated or a comorbidity of hypertension. Now, pregnancy complicated with hypertension, it means that the patient was had high blood pressure before and then got pregnant. So little subtle things, okay, are gonna be there. Inclusion terms located below certain codes indicate some conditions for which code number may be assigned. So this is the one that says, hey, if you have this condition, yes, you can use this term. Yes, you can use this code. So again, you need to know, and you're gonna see how. And I'll go back and forth with this a little bit so you can actually see it when we're looking at the codes. And we're gonna look for codes with a computer. That is a lot easier, but in the book it's kind of the same thing. It's a transcription of that book into the computer. Now, other unspecified codes. It can happen, doesn't happen that often, but there's no code for it. There's no code. And think about, like, for example, COVID-19. When COVID-19 came about, there was no specific, because we gave the COVID-19 a specific name, COVID-19, SARS virus, whatever it is, from 2019, we do not have a specific ICD-10 code CM for COVID-19. Why? Because the last time that we checked the book, we did not include it because it didn't exist at the time. Some things were close or looked more or less the same, but we could not use it. So sometimes really specific and a small number of times, we're gonna use codes that are other unspecified codes, and that means that the ICD-10 CM code does not exist. Okay, for that we will have the non-elsewhere classified, and unspecified codes. Again, if there's if there's not enough documentation or insufficient documentation by the provider, then that's when you put unspecified. And you'll see when we talk about bones, how specific we could get to bones, and unspecified just it's not gonna cut it. If you have a broken ankle, it cannot be unspecified ankle. It has to be left or right. To keep it super simple, I will never use an unspecified code if I want to get paid. Think about it like that. You want to get paid, don't pick the unspecified one. In the exam, they might ask you one that is unspecified, but in real life, in the other side, the insurance that they want you to be specific, they're not going to pay for something that is not specific, even though there's a code for it. Now, there's a few other rules. For example, under a code, you could have something that says code first. So you're looking for a code, and it tells you code first. So that means that code or the other code has to be first. Depends on where it is. So code first and underlining disease. So, and it will say such as, and it will tell you whatever the other code is. So if you have a code first, then that is telling you that either that code or the other one goes first. Make sure that you get the two codes that you need. And usually that's kind of the same thing. You cannot do gestational diabetes without saying that the patient is pregnant first. The condition, the first condition is, or the first state is pregnancy, and then we add things. You cannot say something that comes after the fact because we need that code first. So what is the most important diagnosis? And usually that most important diagnosis will say code first, and some other will say something like use additional code. So it's telling you, hey, this code needs some extra information or some extra code in order to complete it. So again, it will say something like classified elsewhere. Instead of not classified elsewhere like before, now it's gonna say it is. So try to get it in order to do it properly. We have a few other things that we're gonna see. We're gonna say and. We're gonna say due to, in, with. All of those words are gonna mean something to the code. So usually and or is the easiest one. It's gonna be in the list and it's gonna tell you a description. You need to have and or. So you're gonna have both, or you're gonna have one or the other one. Due to, super simple, indicates the presence of something that is causing an effect between the conditions. Again, and here's where it gets kind of complicated. You could have hypertension or high blood pressure due to renal disease, due to medication, due to pregnancy, due to whatever. It might not be due to anything, but if it is, you have to put due to and then get the correct code. There's going to be a code that is non-specific, and as you go down, you'll see that the code gets more and more specific. So due to, it's a really big one. And due to, I'm going to jump in real quick. Due to and with are two different things. High blood pressure due to a renal condition is very different from hypertension and renal condition, or hypertension with a renal condition. So it's either one is caused by the other one, or you have both of them together, or you have one and not the other one. So that's why and, or, due to, and with are so important. In identify the present, again, cause and effect in between two conditions. So now you have something in something else. And again, I'm being super broad about these things, but as we start practicing, you'll see that what they are and how they work. We have a few more. We have the C. Okay, so if you go to you look for a code. Usually when you look in the alphabetic index, it will tell you to go to a code, and then when you go to that code, it will say C whatever. So if you say any word, it will tell you to go to the proper name of that disease. That's why using the alphabetic index or the index is so powerful, because even though if you get it wrong, for example, myocardial infarction, that is a heart attack. So if you look for heart attack in the I can do it right now. I can show you in a little bit. But if I look for heart attack in the index, it will tell me see myocardial infarction. A simple way of, this one is backwards. Why is this one backwards? So again, I'm gonna just do it for just for fun to prove the rule of points. You can look for heart attack. Okay, there you go. At least in this book, you could look for heart attack, and it will tell you look for ST elevation myocardial infarction. Okay, so it's a simple way of saying you could kind of get it wrong, and the book will take you to it. Sometimes it will say something instead of C, it will say C also. C also means that you need to take into account another subterm just to see if it's more specific. Remember, the more specific you can get it, the better it's going to be. Usually you need a greater deal of specificity in order to get the proper code to get the proper payments. So C, again, if you're kind of lost, it will tell you, it will point you in the right direction. C also, it will say, hey, consider this one also. Not that you're gonna pick two, you're gonna pick one of them, but it's gonna tell you to, you know, go to another main term just to see if that one works a little bit better. C category will tell you completely. It will say, hey, you're in the wrong place. Go to the different category. And then C condition also sometimes is you have some symptoms, something that you're looking in the book, and it will tell you, see this condition. These are the conditions that might include that. And then again, this is all trying to take you to the right code. Now, here's a perfect example. We're gonna see it in a little bit. The ICD-10 index for diseases and injuries. I would like them to have conditions also for what I was saying before, pregnancy. So the alphabetical index works like this. It's an alphabetical listing of all the terms and the codes next to them. If you see here the example, this is the alphabetical order of, I'm not even clicking here, there you go. These are in alphabetical order. If you see alphabetical listing of the terms, but then the codes are not in any numeric order. The book is in alphanumeric order. So the first part of the book will start with an A, then a B, then the C, and then the numbers are gonna go in numerical order. So after Q87.19, the next one will be Q87.2. And it's gonna be in order. You just follow the numerical order. But that is in the book, in the actual list. Okay? But in the index, you have them as in alphabetical order. Okay? So if it's easier to look alphabetical order, because if you don't know the actual, what the Q stands for, what the F stands for, what the E stands for, then you need to look for another route. So it's super easy to do it this way. Let me just check alphabetical order, and then from here I go to this code Q87.19, and then I will go up or I will go down to fine tune the actual code. In this one, it says abandonment. Okay, abandonment is a term that we do not have a code for it, but it says C maltreatment. So now you go like, okay, abandonment is included under here. So I will go to this in the index. I will look for maltreatment in the index, and then that one will have an actual code next to it, and then I can go to the code and kind of narrow it down from there. So there's many different ways to look. One of the best and easiest way is through the index, but you still have to understand how the index works. So what are you gonna have? Is someone trying to say something? Yes, no, maybe? Everyone good? You can hear someone. Maybe I'm crazy. Okay. Okay, so we're gonna do specific illnesses and injuries. Specific. This is a specific name of it. Okay, this is a specific name of it, or the name of someone. Look, this guy plus this guy plus this guy created a syndrome or described a syndrome. So you're gonna have a name. You can have abbreviations there. Abbreviations, for example, ST, elevation, myocardial infarction. That's an abbreviation of a heart attack. Or we're gonna have anything that just describes it. An example, like this one, parenthesis, cystinosis. That is a specific name for the one that has an actual name of an individual or multiple individuals. So you can look at it in many ways. Then you're gonna have subdivisions of those things, and then the subdivisions are gonna have the index for the disease and injuries, the tables for cancer and for drugs, and then an index for external cause of injuries. So the main alphabetical listing, like if you're looking at a dictionary, and then all the divisions of the specific letter. So if a code starts with an A, and a code can start A123, for example, all the A's are gonna be of a specific type. All the B's, 1, 2, 3, the B's are gonna be something else. So that is what's gonna be in the index to diseases and injuries. All the cancer is going to be in tables, all the medications are going to be, and chemicals are going to be in a table, and at the end, you're going to have a little section that has to do with external cause of disease, of injuries. And on those, again, we're going to get extremely specific. If you get into a car accident, we want to see if you were driving the car, if the car hit you, if it was pedestrian versus car, if it was car versus motorcycle, if it was you were, for example, if you were stabbed, was it a sword, a knife, machete? It gets that specific, super super specific. So this is an example of the main terms, subterms, and qualifiers. So this first one here that you see that it has is in bold. It says admissions. Admission to what? Then it says for, and then it says see also encounter. So I could look for admission or I could look for encounter. Then it's gonna have a subterm. This, if you see, that's the line where we start, and this is indented. So adjustment, okay? That is a subterm. Then you have another indentation, artificial, so that is a qualifier. Then we have another qualifier, arm, and then complete, okay? So it's giving you extra information. So if I say that the patient, and again, it could be a whole story, well, it says the patient went on admission to the hospital because they needed an artificial adjustment of an arm, a complete arm. So that means that they put screws and pins on an arm. Then that's the code that you should start looking at. So Z44.01 and then some other in order to finish. So now you will go to the book and look for that code, and then from there you're gonna see if there's more specific code. For example, if we're talking, I can see it here. If you're talking about an arm, I want to see which arm was it, the left or the right. Simple as that. And then if it's the first visit, is it the second visit? If it's, and it will get more and more and more specific. But again, this is how you do. You go following, from this one to this one to this one to this one. Maybe you're jumping this one and it's not a complete, it's incomplete. So incomplete will have a different number, okay? And that's how you are going to do it. I'm gonna show you in a little bit. Sometimes this part doesn't make a lot of sense until you start practicing. This one is super simple, so I'm gonna stop here for a second. We are going to talk about neoplasms. Neoplasms are gonna be tumors and eventually cancers. So we're gonna have the actual cancer. Then we have where the cancer is. In this case, it's in the abdomen. It's in a, let's say it's in a cavity, or a specific organ or whatever it is. And then you go from there. You go like, okay, so if it's in the cavity, these are my options: this one, this one, this one, this one, this one, and this one. Okay. And then you have to go to the top and say it's malignant primary, it's a malignant secondary. It means that it's cancer, but it started somewhere else, and then a tumor is secondary. And then if it's in situ, it's a cancer that stays in the organ. If it's a benign tumor and it's not cancer, or if we do not know what it is or it's not specified. So let's say that it's a benign cancer of the organ in the abdomen. So you go abdomen, organ, and then you go all the way to where it says benign, and that will be your code. Maybe if I do it like this. So you go neoplasm in the abdomen, organ, and then you follow all the way to the one that is benign. That's your code. And
I mean, can you do that again? I'm watching, but I mean, how are you coming? I know you was giving the information how to come out with
Okay.
the code, but
So
I'm not understanding.
so the patient has a benign tumor of an organ in the abdomen. So you go, the first thing that we have is neoplasm. So that's a tumor. Gracia, we got it. It is in the abdomen. The abdomen starts there. We got
Mm-hmm.
it. It's the organ, right? So the
Mm-hmm.
last thing that we have is benign. Now you have to look at this top part here: malignant, secondary malignant, carcinoma in situ, benign. And you go down and you match that one with the ones in that list. D 36.7.
Mm-hmm.
Yes or no? Let's try another one. We have uh, uh, we have a malignant primary basal cell skin carcinoma. You don't really need to know what all those things mean. You need to know how to get that from the table. So let's try this. We have a malignant primary. So malignant primary are going to be these codes that we have here.
Mm-hmm.
Okay, malignant primary. And that's why carcinoma is a tumor, right? So now we go and find neoplasm. Okay, so neoplasm or cancer, and we go to skin. So this is abdomen. This is wall. This is wall of the connective tissue. Skin. Okay, and then skin specifically basal cell carcinoma. You have it here. So now that's your code. D44.519. Yes, Vanessa? Maybe?
Oh, okay. How come when you got to scan, you did not circle anything?
Because I'm getting a specific skin cancer.
Okay, so the specific skin cancer is the one you
Correct.
circle before 41519.
Correct. What about,
Okay.
okay, so let's do it backwards. Tell me what type of cancer is this one that I selected here?
That would be viscera.
It's on top of it. So
Hold on, the
there's organ, right? What type of organ? Organ of the abdomen. So it's cancer of an organ of the abdomen, but what type of cancer?
the top part CAIN
A
two.
carcinoma in situ. Now, if you see, it wasn't that bad. All those codes are the same. I mean, whoops, there's one that's not. All of these ones are the same. So if you get close to the code, most of the time, most of the codes are the same. So it gets super simple when you're close because you're doing it backwards. You go like, okay, I have a neoplasm of the abdomen, and then I don't know if it's cavity, organ, or viscera. But look, cavity, organ, and viscera, they have the same code. So that's it. That's your code. Code D09.8. Yes, no, maybe we're gonna practice this a lot more. This is just a
Getting there.
a little tiny example. I see some people saying, so easy for now. I like that. Easy for now. Like, it might get complicated, but it's not. It's not. It's gonna. You'll see. You see that it will work. So let's continue. So again, it's kind of like a multiplication table. You get numbers in one side, numbers in the other one, and then you combine them to get a specific number. You'll see it's a lot easier when you do it in a computer, but in the exam you're gonna use the book, so I need you to learn how to do it from the book. Okay, now you're gonna start. What is that? Okay, let's say it's nothing weird, right? So let's try that. Okay, we're Vanessa, let's use you again. Perfect. I have I there's someone that I don't like, and I force them to take. What is all this craziness here? Let's do the first one, okay? Oh, and if you can pronounce it, I'll give you an A right now. Let's try it. 14 hydroxy dehydromorphine. There you go. Jesus Christ. I gave I gave someone that. I wanted to kill them. I want them to die, and I gave them that, right? So what will be my code? Well, my code will be any of those, right? Because that's the medication that we gave, or the chemical that we use. Was it accidental?
Poison intentional.
Intentional, poison intentional, self-harm, or assault, or undetermined, or adverse effect, or underdosing. Okay, so let's try it. I said that we gave this individual on purpose in order to harm him or her. So what would it be?
The T40 that under the poison assault.
Assault. So now we are T40 to X3. X. In that case, X is a placeholder. Okay.
I got an A.
No, you needed to read the word and pronounce it properly to get the A. Well, you're good.
You didn't tell me. You did it on your own.
No, we're good. We're good. You see? So now you go like, okay, I got that one and that one. But if you look at the codes, look at them. They are all the same except the last number 2. That's a 1, a 2, a 3, 4, 5, 6. That is how specific it gets. It gets to the specificity of the last number being different. If the individual wanted to kill himself, for example, then it's going to be poisoning intentional self-harm. It will be on that column down. And then let's say they were going to do whatever. Let's do the second one, propranolol. Then propranolol for intentional self-harm will be this second one there. Is it making sense for everyone?
This one, yes.
Okay, that's okay. I'll take that. I'll take that one. So they're kind of the same thing. The only difference is that we have all these words here that are kind of confusing you, maybe. But this top part goes right here, just like this one. So imagine maybe taking all this. Okay, let's do that. I got you. You'll see. I'm gonna make this disappear. And I'm gonna make this thing here. Maybe this way will work.
Oh, you're organizing them.
No, I'm making a little boxes over them. That's gonna work better. You'll see. Now, Perfect. Well, not perfect, but good. Good enough, right? Now, go. Tell me, what is uh, squamous cell carcinoma? What will be the name for it? What will be the code for squamous cell carcinoma? There you go. Neoplasm? Abdomen? No. Wall? No. Skin? Okay, skin. And then at the end, squamous cell carcinoma. How many options do we have? We only have that one, right? C44.529. So that means that the squamous cell carcinoma can only be a malignant primary cancer.
Mhm.
Yes, maybe.
But
No?
quick question.
Go.
So, in order for you to define the actual disease, like you see how you went in order,
Mhm.
neoplastic, skin, squamous cell, carcinoma, that information would be provided to us, and then that's how we
Of
find a
course, of
code.
course. Yeah. That all that.
Oh, okay. I'm like, how am I supposed to
No, 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 no,
determine?
no, 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 no. All this crap, all this is gonna be given.
Oh, okay, that makes sense.
Yeah. Like everything is gonna be given. I give you, I give you the information, and then you find the code in either a table or like this. Like in the next one, I need to tell you two things. I will tell you what the medication is. So let's say we're doing this last one here, this medication, and then I have to tell you that it was an adverse effect of the medication. So now, what do? Well, you go. It has to be one in this. You go like it has to be in this one, and it's this last one. So yeah, there you go. That's it. T48.6 placeholder X and 5. It's always going to be given. Remember, all of this happened already. You're getting the information and the transcript from things that already happened.
Got
So
it.
I'm going to tell you what it is, and then you get the code. You do not have to diagnose. You don't have to look through many documents. No, you're gonna get the document that has the what happened, and it's gonna say it in plain words. Accidental poisoning. Accidental poisoning with this thing ABOB. Well, ABOB. That way, accidental poisoning this way. Here's your code. Everything, all the information that you get is going to be given to you guys. You don't have to make it up. You don't have to figure it out. What you have to figure it out is what code goes with that.
Got it.
Good. I like it. Oh, and something, if you are, again, I imagine you by now you should trust me. But if you read this tiny letters here, it says courtesy of Centers for Medicare and Medicaid Services, www.cms.gov. Everything is there. Okay. I don't want to make this all bigger because when we zoom in, this kind of gets funky. But um, we had the word abandonment before, and then we have abuse. We could have accidents, and look at the how specific it gets to uh, to an accident. Aircraft in transit, powered. See also accident transport aircraft. Due to, caused by a cataclysm event. So a hurricane, for example. Go to forces of nature by type. Accident uh, in animal rider. Think about it. You fell from a horse. Go specific. Accident in a car. Barefoot water skier. Look at how specific it gets. Boat accident. Striking a swimmer. Powered. What if a kayak on-power kayak hit a swimmer. There's a code for that. V94.12. But if the boat had a motor, it's not V94.12, is 11. That's how specific it gets. That's why we have 75,000 codes.
Wow.
Look at this one in the bottom here. It's kind of the same thing. Yeah, the watercraft again, it's the same. But again, it's super specific. I want you to understand. Look at this. It says water transport accident, and then it says exclude military watercraft accidents in military or war operations. So if it's a military accident, it's a different code than if it's a actual boating accident in the not military related. That's how specific it gets. My bad. Okay. Some other things are gonna be difficult to find in the index, okay? Because they're gonna have words that accompany the thing, like abnormal, anomaly, complication, delivery, disease, disorder, findings, infection, injuries. If you look for injury, you got all the injuries in the world, right? But under injury, you're looking for a fall or whatever. So you have to make sure that you get it. So if you do not find the proper word that you're looking for, then you will have to go all the way to the original part of that whatever word you get, injury, for example, and then start going down blocks by blocks until you get it. Again, that works. Takes forever, but it works. Some words you need to try to get by using specific codes that go on the top. Neoplasm, for example. Neoplasm means cancer. How many cancers do we have? How many different types of each of those cancers we have? Many of them. Pregnancy. Again, I told you, with one baby, with two babies, is the first pregnancy, the second pregnancy, is the first trimester, second trimester, with complications, without, there's so many of them. Injury is one of the biggest one. When we talk about fractures, we're gonna see fractures today. It is so big, it's so specific. Each fracture, think about it. We have around 206 to 207 bones, depends on who you are and what book you read. Each one can be broken in multiple different places. So that takes that number to around 500 fractures that you can get. Each fracture might have between 7 to 9 codes for each one, depending on where the fracture is, if it's the first time that you see a doctor, if it's the second time that you see a doctor, if it's a complication after a fracture, like every single fracture. So we're talking about 500 codes that are going to have around 6 to 7 codes each one. So now we're talking about 3,000 codes for fractures, probably more, around 5,000 codes for fractures. So out of the 75,000 codes, 5 of them are fractures. 5,000 of them are fractures. So if you go to an orthopedic surgeon's office and work with them, the codes are extremely specific, extremely, specific for payments, and for and they change from one visit to the other one. Those are the only codes that have that that include the visit in them. It's something else. I'm going to show you in a little bit. But again, if you understand them, broad, you should be fine. There's a lot, but because there are a lot, you can zone in into what you need, and then you can kind of make it into 6 and 7 codes, and you select between those. So these are the how things are organized. First we have the index that we talked about. Then we have a chronological list of codes. So that means that they're gonna start in order. Remember, these codes they have a letter at the beginning. So the first letter is gonna be the first part of the code. So they are gonna be in alphabetical order. So the A's, then the B's, then the C's, then the D's. You know, following your alphabet, and then each number after that. So if we have a code that starts A00, just make it that code. Then the next one will be A01, for example. The following A02. Now, if they have more numbers here, then you could have multiple, but they are in order. They follow a specific order of numbers, and then we call it chronological because it includes the letters and the numbers. They are organized in 21 chapters. So 21 chapters uh, um, of all the codes. Again, basically letters in the alphabet. Not all of them, not in the same order that the codes are. Specifically, the letters. The letters are gonna be the major chapters. They're gonna be a major topic with headings in the code book. Then they're gonna start going to categories, and categories are gonna be 3 characters. Then subcategories are gonna be 4 to 5 characters, and then we could go all the way to 7 characters. So what I'm saying is that a code could be something like this. Okay, uh, let's do A. So A 1 2 3 dot 1 2 3 4. So it could be a code could be something like A 0 0 0 0 0 0, for example. And the next one will be A 0 0 0 0 0 1. Now we do not need to have that one. It could go to not that one, and it could go to A 0 0 0 0 1 instead of the last one. Or many combinations like that. Again, some of the codes might need a placeholder. So sometimes you saw a little X in between 2 numbers. So that is a placeholder. I'll show you how that one works. And it's in order to hold the place for the last code or last digit for the code that we need. So if we have something like 7 digits, it's always, actually clear this. So let's say I have A 1 2 3, and then we need a placeholder to get to the last number that has to be 1. So I could have 1 placeholder, I could have 2 placeholders. Again, you understand that a little bit better, but whenever you see an X, the X means placeholder. We are putting that thing in a spot. So in the 7 digit, we could put something else, and that 7 digit could be a number, or it could be a letter. For example, it could be an A at the end. It could be an S. Okay, it could be an I. So you'll see that when we get there. So again, who has those 7 digit complicated codes? Fractures. You cannot see this, so I'm not going to actually show you this. I could show it to you. Let me see if I could get it here real quick. Let me stop this here real quick. So far, so good. Are we understanding? Are we learning?
7 digits codes are the fractures.
Say that again.
No, repeating the 7 digits code. You say those are the fractures.
They fractures for sure have 7 digits. Not all of them have 7 digits, but fractures have 7 digits. Okay, let me show you this. I think the one in the PowerPoint is chapter 16. So chapter 16 is O. Oh no, it's P. There you go, but you're looking at this. My bad. Let me put it back so you can actually see it. Let me know when you can see my screen. Yes, thank you, thank you. So in your so this is basically, I don't know what this huge thing is. Please go away. So many ads. Because this is free, I have a bunch of ads, but icddata.com, icd10data.com, you will find every single code. And like I was saying, the book is in order A000, then the B's, then the C's, then the D's. Okay, but let me open the A's real quick. That is infections and parasitic disease. Please work. There you go. So now you have all the A's and all the B's in order. A and B has to do with infectious disease and parasitic disease. And it tells you, use additional codes. It will tell you which ones. Type 1 excludes, includes, whatever it is that it says there. And then you have all the different codes. These are all the codes that we have. Intestinal infections, TB, tuberculosis, infections with sexual transmitted disease, viral infections, viral hepatitis, HIV. Yes or no? I got people in the chat. Is it going kind of crazy? Oh, we lost people. What happened?
Right here.
I lost one. Okay. So this is for the ones that kind of lost it for a little bit. ICD10data.com. It's a free site where you can get all the codes. You will click on ICD-10 CM codes, and it will tell you, it will show you a page with all the codes that you have available. So these are the chapters from the book, from A00 to B99. They're gonna be all infectious disease. From the C and D will be cancer. The last part of D will be disease of blood. And each one of them will have a specific letter and where it's going to start, where is it going to end. The last one is C00 all the way to C99. I opened the first one that has to do with infectious disease. Start with A's and the B's. All the A's and all the B's are going to be in this first chapter of the book. Then you could go to the specific disease. Let's say we want to see the first ones. Intestinal infectious disease. You click on it, and this is how it's going to show all the A's, okay? All the A's that have to do with intestinal infectious disease. Not the B's, not all the A's, only the ones that have to do with intestinal infectious disease. So let's do salmonella. Let's pick salmonella. A02 is the main part of salmonella. So we click on it. I need to get a better page. This is ridiculous. So many ads. But it's free, so and you can use it too. So I'm not complaining that much. Okay. So this is now what you have: salmonella. Okay. Salmonella in your intestines. Sepsis because of salmonella. Localized salmonella infections. Meningitis, pneumonia, arthritis, whatever it is. So let's say you have salmonella in your intestines. So we click on it, and now it says here on top, this is a billable specific code, and it will give you all the information on, and a bunch of ads on what the code is. In this case, the code is A02.0. Okay. It says billable specific code. It's telling you this is a code that you can use for reimbursement. Then you go to synonyms. Salmonella gastroenteritis is a synonym of the code. Clinical information: poisoning caused by ingestion of food, harboring a species of salmonella, and it will tell you all the things. If you're not sure, or the doctor is not sure, you can always go to to the clinical information and say, yep, this is going to work or not. And then when you go all the way down, it tells you, you know, what is it, what it includes, if you have to put an add-on, if it's due to something. So let's say it's intoxication, foodborne. So you ate something that was bad. Okay. So again, any salmonella without information, you go like, okay, ACO2.9. But if you know that it was poisoning because of food, or intoxication because of food, uh, or intoxication because of food due to salmonella, it's the same number. So you can check and you could be almost sure that the number that you're looking for is that one. So that's the number, and you are going to select that code, ACO2.0. That code has only 4 digits. The first one is an A letter. The next 3 digits are going to be numbers. No placeholder, no need to go more than 4 digits in this code, because it works. Yes or no? Maybe. Anyone? Did I lost you guys? Okay, thank you. Let's go to pregnant females real quick and show you a few of the complications of pregnancy. Uh, let's do pregnancy. Okay, let's do high risk pregnancy. So the pregnancies are the O's. High risk pregnancy is O09. And then when you pick O09, you have to make it a little bit more specific. So when you click O09, again, supervision of high-risk pregnancy, it's going to open and give you all the different, look at how many codes we have, okay? Those codes are for specific, or to make it as specific as possible. So I just said high-risk pregnancy. But high-risk pregnancy is not enough. It's not a billable code. We need to know what is more specific, right? So why is it this is a high-risk pregnancy? It might be because the patient has history of infertility. So that code now is going to be O09.0. But that's not a billable code. We need to make sure what trimester that patient is. So if you do not know the trimester, unspecified trimester, O09.00. If the patient is in the first trimester of a high-risk pregnancy with a history of infertility, then it's going to be O09.01. If we are in the second trimester, it's going to be 02. If we are in the third trimester, it's going to be 03. If the patient has a supervision of high-risk pregnancy, not history of infertility, history of ectopic pregnancy, then it's going to be a different number. First trimester, second trimester, third trimester is going to be a different number. And just keep going. You pick whatever you want. You can pick whatever you want. Supervision of an elderly multigravida, so a lady that has had kids before, but she is over 45, between 45 and 50 years old. Okay. Oh, what trimester? So think, this gets specific, specific, specific. Okay. Yes. And at the end, this one says supervision of high-risk pregnancy unspecified. We don't know what the risk is, and we still have codes for it. Other high-risk pregnancies. We know that it's not any that is in the list, but we have codes for that. Does that make sense? Are we following? Yes. Now, before we go back to the PowerPoint, I'm going to show you one more. I'm going to show you fractures.
No tuviste que romper el piso. Oye, pero qué curiosidad. Muchacho, qué curioso está eso. ¿Qué?
I did it wrong.
Qué curioso. Muchacho, esa jodera con el agua. Ay, mi madre.
There you go, injury.
¿Eh?
There you go. Uh, let's do ankle. Let's break someone's ankle. Fracture of a foot, toe except ankle. So let's do fracture of the actual ankle. Oh, it's only okay. So let's do this one. Open wound, fracture of foot and toes except the ankle. So foot and toes. Let's go all the way to the foot and the toes. And you might say, well, what can you break? Well, you can break the calcaneus, the talus, other tarsal bones, great toe, one of the lesser toes, anything. Look, anything. So let's say that we broke our great toe, or someone broke their great toe. Okay, how many codes can we have for that? And you open it and look how beautiful it is. That's a broken toe. Look at all the codes for a broken toe.
Oh.
What? So let's start. Who's that talking to? Vanessa, pick left or right?
All right.
Right. So we broke the great toe. Let's say that. Okay. So from 1 to 5. Number 1 is great toe. 2, 3, 4, 5. 5 is a pinky. So pick a number. 1 to 5. 5. So we broke the pinky toe of the right leg. Yes, of the right foot. Let's do that. So we go great toe, no. Left great toe, no. Unspecified great toe, no. So let's go all the way to the bottom because it's gonna be almost at the end.
Can you press when you're in a computer? Can you press like the control to find that quicker?
You can go all the way up and you can search it through here.
Okay.
Why do I still have great toe? I don't want great toe. Did I put great toe only? Yes. So I was in the wrong one because we talked about the great toe. So now we said pinky, right? So let's go. You said pinky, right toe.
Pinky, right toe.
So middle phalanx is not because it's the last one. Middle phalanx. Oh, the bone has 3 little sections. Which section you broke? The tip, the first one. This is how complicated it gets.
Oh, wow.
Okay, so let's see. It's a displaced fracture, non-displaced. Let's make it a displaced fracture of the right lesser toes, and let's make it. Is this open or a closed fracture?
More to it?
Yes. So let's say it's a closed fracture. Let's say you hit your pinky toe really hard with a wall or something. So you have a displaced, unspecified fracture of your right lesser toe. It is a closed fracture, okay? And is this the first time that we see the patient or if it's the second time that we see the patient? Let's take it, it's the first time. Look, that's the code. S92.501A. That has 7 digits. But you can only use that code once, because the second time you see the patient, even though the same thing is going to happen, it is displayed some specified fracture of the right lesser toe, but it will be a subsequent encounter. And now that subsequent encounter, is it healing? Is it not healing? Is it a malunion? Is it a sequela? So many things can happen. So let's say it's routine healing. So this code that we're gonna click here is specific to a displaced unspecified fracture of the right lesser toe, subsequent encounter with fracture with routine healing. This is how specific it gets. But you could follow it by just doing what I did. And this is what you're going to do in the book. Because in the book, you cannot search in a search bar. The computer's going to look for it. You have to go, okay, let me go to fracture of the. So first you go to fractures or injury, then legs, then toes, then fracture of the toes, what toe, the first one or the lesser toes, and then from there you're gonna go, okay, so I'm looking for the right. What if it was the left? If it was the left, it will be this one, a 592 502 instead of a 1, and then A, B, D, whatever it is. So it gets specific, it gets detailed. Now, because the information that you are going to get is going to be this one, so you have to turn this code, all these words into a code. And because you're looking part by part, then it's super simple to get. Yes, maybe. Don't get scared now, people. Don't get scared now. This is just the beginning. Okay, let's go to this. So the same thing that we were looking there is how you're gonna how is it gonna be seen in the book. So in your book, you're gonna see things. Actually, no. Let me know when you see the screen. I think you should be able to see it now. But you see the screen? Yes. No. Maybe.
Yes.
Yes. Okay. Thank you. Thank you. Thank you. So let's see. So this is this is for pregnancy, or prenatal. So that's starts with a P. So that's PCO0 all the way to P90, and then specific things that you have there. So just like we saw that one is a term, subterm, then subcategory, and then at the end the specific of the code. So if that's not sufficient, you go to the next one. I always tell you, go to the code. When you get to the one that you think it is, look for the next one, the one in the bottom of it, and tell me, would that one work? Or go to the one before that. And usually that's what you're gonna say, no, this is the one. So when I say go back or go forward, this is what I'm saying. If you selected this code here, I want you to check the one from before, the one that is exactly over it, and the one that is exactly under it. Because at that point, you're gonna say, okay, this one can be, it has to be this one in the middle. Usually it's simpler than that. You plug in the name and it will tell you exactly what it is, but again, super tiny one. I'll show you now in the other way. So this is C for the disease and the injuries. You will see how specific it gets. And again, there's some guidelines that you're gonna have from coding and for reporting. All those guidelines are gonna be given to you by Medicare, so you can download it from their website. And again, you just need to make sure that you know what the things are gonna be like the rules and the things are gonna be for, because if you get them wrong, then it's no payment. Remember, the what we get paid for is for the procedures. These are not procedures, these are diagnoses. So again, let's keep making the same example as always. I'm writing over here and you should right now memorize this number 299203. But it's a outpatient visit, pays around $300. If the patient has a broken leg and we bill a 99203, it pays $300. If the patient has the flu and we bill a 99203, it pays $300. If the patient had a heart attack and we bill a 99203, it pays $300. If the patient has a regular checkup, a yearly regular checkup, and we bill a 99203, it pays $300. It does not matter what the patient has. That does not give the price. That does not give the revenue. That does not give the reimbursement. What gets the money attached to is the procedure. So if the procedure is a $10 procedure, I don't care if you got it because you had a heart attack or because a mosquito bit you and got infected. The price has to do with the CPT, has to do with the procedure. But you cannot have a procedure without the why. And the why is going to be the ICD. You got intoxicated, that is why we are doing whatever. The why. You got a heart attack, that's why you're getting an x-ray, that's why you're getting an echo, that's why you're getting an MRI, that's why you're getting an EKG. An EKG for a heart attack and an EKG for a plastic surgery. To clear a patient for a plastic surgery, you need an EKG. What we're trying to say with an EKG for a patient that has a plastic surgery is like your heart is good enough to handle the anesthesia and the procedure. An EKG for a patient that had a heart attack is, oh my God, this patient is going to die. Let's see if we can do something for him or her. But the cost of the EKG is exactly the same. The reimbursement for the EKG is going to be exactly the same. If we bill a code, that code does not matter what the ICD code is, it will pay the same. But it has to be a code that matches the CPT. So, you want to memorize how to do it? What are the guidelines? Here you go. We're going to go over them, all of them. At least I'm going to read all of them. So, you know, the first thing that you should do is go through the tabular list or the index, okay? And then the tabular list is going to have all the codes from A00 all the way to C99. Then you need to accurately report the ICD code. The code, you have to check for the descriptions and signs. You have to check if there's any other circumstances, and there's going to be the injuries and the C codes. Why you have a broken leg? Why you got intoxicated? Why? And that could be finding the C code. So you need 2 codes for that. Then go to the level of detail that you have to in order to get it. Then code for the ICD-10-CM. Get the right one. And sometimes including encounters, visits on certain procedures. You go to the chronic disease if the patient has some. Code all documented conditions. Not only the most important, not only the thing that you think, the one that you think that is the one that's going to get you the more payment. They do not give you more payment. Sometimes you need to code for 3 or 4 conditions in order to bill for a specific code in the CPT. So code for all of them. That's the only part where the more the merrier. Like if you code for more things than what you're supposed to because the patient had them, that is always beneficial. Not in the CPT, because in the CPT they might think you're committing fraud or abuse, but here all the things that you know and that you checked have to be, or that the doctor checked, have to go there. There's some patients that are receiving diagnosis only, so then that's good. They could be receiving some treatment, so that has to be included too. Pre-op evaluations only are going to have specific codes for those, because you're not doing the actual procedure. So it's like a diagnosis for a procedure. Ambulatory surgery is going to be different. Routine outpatients, prenatal visits are going to be separate. Encounters for general medical examinations with abnormal findings are going to be different from the ones that don't have abnormal findings. And then encounters for routine health screenings might not have a diagnosis. Okay, healthy baby visit. You take your baby, and we're doing an evaluation and management. What is the diagnosis? Nothing. The patient does not have a diagnosis, so that's a routine health screening. What doctors try to do is just find something to put it, because it's easier uh, to code for something that the baby has than to say 100% sure the baby has nothing. Uh, and that's health screening. And then the last one, the last page that we have here, uncertain diagnosis, also called qualified diagnosis. If there's something that is suspected, questionable, or ruled out, or working diagnosis, those terms indicate uncertainty. So one of the things that could happen is that you go to a hospital, and they will say, so the patient has chest pain and difficulty breathing, rule out heart attack. That doesn't mean that the patient has a heart attack. It means that the patient could have a heart attack. Okay. The patient has alcohol intoxication, suspected suspected harm, self-harm. The patient had a bunch of pills in the system. They drank a bunch of pills, suspected self-harm intoxication. That doesn't mean that that's what happened. It means that that's what you think it happened. So when you have those things, in those some little tiny cases, you can use qualified diagnosis, like where did it came from. So again, it's more things that we have to add to the diagnosis, but still it should work. I do not know if you can see that I changed screens. Can you see that? I need someone to tell me. So I'm at the PowerPoint,
Yes.
and then
Dr.
and now do you
Dr.
see that
Indaki,
I'm back
very much.
to the other one?
Yes.
So I don't have to do all the fancy things that I was doing before. Okay, my bad. Let's go to factors influencing health or like basically injuries. So the C codes are codes that we're going to use to represent reasons for the encounter. Okay, so why are you there? Okay, some circumstances are going to have why the patient is there. It's not a specific diagnosis. It is something, okay, that is going to say, hey, the patient had this or that. One example, or something that will give some extra information. One example is blood type. Blood type is not a diagnosis. It's not a condition. It's not a state. It's not a thing. It's blood type. It is a finding. So if you have to put down the blood type of the patient in the medical record, and you have to use a diagnosis for it, then, well, these are the blood types. That is not a diagnosis. Blood type type A is not a diagnosis. I mean, actually, blood type A positive is not a diagnosis. It is a finding. But we have a specific code for each and every single blood type. Type A blood type Rh positive, that code, or Rh negative, this one. So AB positive, that one. AB negative, that one. Blood type O positive, this one. O negative, this one. And again, that is not a diagnosis. That is not a diagnosis, and still we have it there. So it's something that will give more information. So you might have a diagnosis, and then for whatever reason you need to have that that extra information there. Does that make any sense to you guys? We are putting more information into codes. Symptoms are not diagnosis. Pain is not a diagnosis. Okay, so we have special codes for special things. Let me show you. So we have the R's, R00 all the way to R99 for symptoms. Those symptoms and those clinical lab results are not a diagnosis. Okay? Look, signs and symptoms in the cardiovascular system, in the digestive system, in the skin, in speech, general signs. Those general signs. If you working at a doctor's offices, like for general doctors, will use general symptoms a lot. So the diagnosis is one thing, but then the accompanying signs could be here: fever, pain, syncope, collapse, like you're shock, bleeding, lymph nodes, anything. Pain, something as simple as pain. If pain is not specified anywhere else, pain is a symptom. Pain is subjective. Everyone has different types of pain. Now, look what it says here. Pain is R52, but it excludes all this type of pains. Pain in the abdomen, don't use R52, go to R10. Back pain, go to M54.9. Go and you keep going. Breast pain, chest pain, eye pain, ear pain, joint, a headache. You cannot, for pain, you cannot use any of those. If you have pain in any of those parts, you have to click on this one and go to whatever it is. So pain, it has to be completely unspecified. And my question is, if I ask the patient, or we say the patient is the patient has pain, the least that you could do is tell me where the pain is. We do this to kids. You say, hey, little kid, with one finger, point at exactly where the pain is. And they point in their face, in their nose, in their ear. It's simple. But pain that is unspecified is pain that we don't know where it is. And that makes no sense. So insurance companies are not going to pay for a code that says unspecified. So patient has a headache, that's pain in their head. You cannot say pain. You have to go to here where it says headache, and it says R51.9. So we click on that one, and that will take us to the proper code that we should use for that pain. And it says it is a billable code, but then you have to check what are the options. And these are the options. You have a headache that is chronic, daily chronic is kind of the same thing. Nasal septum headache, or is it pain in the face? If it's not pain in the face, you can go somewhere else. So excludes those pains. So R52, and you can go over the thing, and it will tell you that it's one of the other pains that we did not specify before. So there you go, one code for a headache. Someone asked before, can you use fancy ways to get to the codes? And I say yes, you can search. I don't know if you can see this. Let me close this so I can see it. Let's search. And I have a fun one. You go drinking. Okay, you go drinking, and the next day you have what? What do we call the next day? of drinking a lot?
Hangover.
You have a hangover, right? Okay. Hangover doesn't sound like a really, you know, college term, medical term. So hangover, but the patient is not going to tell you what they have. They have a hangover. They were drinking yesterday, and today they feel like really bad, right? So let's say if I put hangover, okay, I put hangover on the search, and you can do this in the book too. You can look for hangover. You go to the index and you look for hangover, and then you search. When you press search, it will tell you, it will give you, if hangover is an option, it will tell you, look, there's a code T51.0. It says toxic effect of ethanol. Ethanol is alcohol. And then it describes what it is. It's acute alcohol intoxication or hangover. And it teaches you this numbers. It includes all of those. So let's go. We click on the thing, and let's see. You ask the patient. Oh, you didn't ask the patient. Oh, they already asked the patient. They already wrote all the information. So now you go, okay, let me see what this code says. So apparently it looks that is acute alcohol intoxication. So acute means that it's something that happens really fast. So it's happening now. Come on. There's something that is happening now. So it's acute, happening fast, and intoxication that you have that. Why is it taking so long? There you go. Something disappear now. There you go. So acuity happens. It happens fast and it goes away fast. So again, a hungover, you start drinking too much in a couple of hours, and then the next day you feel like crap. But for a little bit, for a few hours. So it says exclude. So toxic effect of alcohol, it excludes hangover. So that means that we cannot use this toxic effect of ethanol for a hangover, because it says type 2 excludes hangover. Hangover is going to be any of these codes. So we're going to click the first one. So now we are at what a hangover is. And it says hangover is alcohol abuse with intoxication. That sounds about right. You were drinking too much and now you're intoxicated. But it says unspecified. Usually when you have that last number being a 9, it means unspecified. So I don't want an unspecified. I want to specify it a little bit more. So we go here. So we said that it was alcohol abuse with intoxication. So you go down and it says abuse of alcohol with intoxication. Yes? Excellent. But it has a 9 there. And I want to make sure that I get it as, to the best one that I can get. Okay? And now I go with dependence or without dependence. So are you a alcoholic, or were you just celebrating someone's birthday and you had too much to drink? So that is without dependence. That is someone that went on a night out and drank too much. F10.129. Excellent. Perfect. Now, if it's with dependence, in this case, it really doesn't matter. Because with dependence or without, with dependence, pathological or not, it's the same one. So because it's the same number, there's nothing else to look for. That's the number, F10.129. You go to the one that is before that. The one that is before that is F10.10. But there's one extra, with intoxication or without intoxication. Like if you are intoxicated, that's the hangover part. So it has to be that one. Simple. We have a code for a hangover. We have a code for a broken toe of the right leg, displaced or not, open or not. Super, super, extremely specific. Yes, no, maybe. Yes, I see yes. Let me see what else I can get that is interesting. Let me see if I can get someone I want to see if I can get. Let's do this one. Injuries to the head. What type of injuries can we have to the head? Based on this, we have superficial open wound to the head, fracture of the skull, dislocation or sprain of a joint, cranial nerves, eye, crushing of the head, anything else. So let's try crushing of the head. Crushing injury of the head. And again, you might go like, what? So crushing of the face, crushing of the skull, crushing of other parts of the head, initial encounter, subsequent encounter. So this is an example, and I knew that this one's gonna have this. This is an example of a code that has 2 X's. So it has 2 placeholders because the 7th digit is used for the type of encounter. So even though that we don't have anything else before it, we have to put 2 X's so the A gets to the 7th digit. It's taking forever to open, so sorry about that. I think it's all this video ads. There you go. Here, this is what I wanted to show you. So SO7.1 and then XX, 2 placeholders, and then the A. That means that this is a crushing injury of the skull, specific, not the face, and the initial encounter. This is the first time we see this patient. But we cannot use this again because the second time that we use it, we need to change that to another letter at the end. So for that, we'll have to decide what is the secondary injury, like secondary or subsequent encounter of. So instead of an A, we're gonna use a D for the subsequent encounter of a crushing injury to the skull. So this is how specific it gets. Another one that is really specific is pregnancy. I show you a few of the pregnancies. Let me see if I can show you one more, and then I'll show you the tables for neoplasms. So sometimes I'll show you students some tricks in order to learn things. The way I memorize most of the things is by using kind of a play with words. So the C's are gonna be neoplasms. Neoplasms is the same as cancer. So if I think cancer, I think that is gonna be under C. If I do, for example, P is for perinatals, or like before the pregnancy or pregnancies. But then O for obstetrics, and that is the pregnancy and childbirth. That's kind of a way that you can try to do those. So many of them match a word or a letter they could use. E for endocrine, stuff like that. So you can learn them like that if you want. Prenatal, obstetrics, super simple. The O's and the P's. So now you go to the O's again. You need to think about trimester. You need to think about, and again, this is another thing. What is the first trimester? Okay, first trimester has to be exactly less than 14 weeks and no days. So if you have 14 weeks, you are already in the second trimester. 13 weeks and 6 days will be the first trimester. So the first trimester is from the beginning of the pregnancy to 13 days and 6 days. And you might say, well, it depends when their last menstrual cycle was, or whatever method you use to say what trimester the patient is in or the pregnancy. That's what you're gonna use. Anything after 14 days and 14 weeks and 0 days, all the way to 27 and 6 days will be the second trimester, and the last trimester will be from 28 all the way to delivery. A few examples like that. And again, it depends when is it calculated. It could be calculated with the last menstrual cycle. Sometimes the individuals don't know that, so we have to use sonographic evidence in order to calculate it. So whatever we use, that's what you're gonna get. Let me see if I can do. There you go, delivery. So when we're talking about delivery, well, you might delivery. What is the code for delivery? How many deliveries can we have? Well, it's one. Okay, no, we could have full term, uncomplicated, and that's the one that we look at. But we could say C-section without indication, and that's kind of a different one. So let's say the simplest one, encounter for full term, uncomplicated delivery. Excellent. This is an individual that is pregnant and has no problem. Nothing has happened to her. Everything is absolutely perfect. Okay, so how many codes can we have for that? Well, not many, right? If we're going to do admission to delivery, full term, uncomplicated, that's it. If it's completely a normal case, if it's spontaneous, if it's term pregnancy, perfect, uncomplicated, nothing. One code, okay? One code. Now, look at what it says here. Maternity diagnosis. You have to be between 12 and 55 years of age. If you are before 12 or after 55, that is not the maternity diagnosis. After those two, like before 12 and after that, is going to be a complicated no matter what. And then you have this one that says female diagnosis. What if I put this diagnosis on a male patient? That would not match. If you try to do that, the computer will start saying, wrong, wrong. You cannot do that. Okay? So again, that's an example of all the things that you can see. Let's go back to the C-section. So again, uncomplicated, nothing. It's just an encounter for delivery. You're getting to the hospital and you are going to deliver this baby. No indication. So that means that you just decided to go and this admission or delivery of a full-term baby, uncomplicated, C-section, 082. Delivery full-term, uncomplicated, without the C-section, 080. Delivery for a C-section without indication, and then if it's a full-term uncomplicated, that one, if it's C-section, is this one. Simple. Does that make sense? This is a female only, okay? Only for females between 12 and 55. Before 12 and after 55, it's gonna be considered another code, complicated, and then you have to use different codes for that. Simple, beautiful explanations. Let's do a few more. Here you go. Okay, now this mom had an uncomplicated pregnancy, but she has multiple, she's a twin or triplets or whatever pregnancy. How many codes could we have? Well, look, if you do not have one baby and it's not complicated, then there's so many codes that you could decide from. So multiple pregnancy with twins. Okay, multiple pregnancy with twins that we don't know how many placenta, how many amniotic sacs in the first trimester, second trimester, third trimester, or we don't know. if we know that we have one amniotic sac and one placenta, and we have a twin pregnancy, then what trimester? What if we have triplets? Why if we have 4? Why if we have more than that? Like any combination of those things, we're gonna have one. If you do some crazy things and we don't know how many kids you have, or we have more than 4, then we have to go to other specified gestation. It could be 5, it could be 6. We have all the way until 4. So if it's 5, it goes to other. And then the same thing, how many placenta, how many amniotic fluid, amniotic sacs, yada, yada, yada. Okay? So this is how specific it can get. A twin pregnancy only has that code 030 that we cannot use. It has to be more specified than that. 030.0, no. 030.00, still not. Now you have to go to all the way to 6. Sorry, to 6 digits in order to get the right term. If you click on any of these ones, twin pregnancy, like this one, like this, that has a little red arrow there, it will say really big, it's 6 forever, but it will say this is a non-billable, non-specific code. So when a code is non-billable or non-specific, you are not going to get paid for. It tells you you need a code that has a greater level of detail. And if you don't know what that is, you click on it and it will tell you it will take you to the one that you have, and it's going to mark it as this is where you were. I need one that is a little bit more specific. And then there's 4 for you to select. Unspecified trimester, that means that you don't know what trimester the patient is. But if you know first, second, or third, then that's the code that you're going to use. Yes or no? Are we understanding this? Are we getting? Yes. I know it gets a little bit funky, a little bit complicated. This is 21 chapters. Inside each of these chapters, neoplasms, we have many subsections, and each one of those subsections has a bunch of things. C for cancer or neoplasms. We could go all the way to, let's do breast cancer. Breast cancer is C50. And here you go, malignant neoplasm of breast. And you click on it and you might think, well, not a lot of information on cancer. Look at all the codes that we could have. We could have malignant neoplasm of the nipple and the areola. Malignant neoplasm of a male patient or a female patient. Malignant neoplasm of the central portion of breast, female. The same thing on the next one, malignant neoplasm, certain portion of right breast of male, or the left of male or female. Upper inner quadrant, breast, male. Lower inner quadrant, breast, female. Any combination of all those things. And for the ones that are asking, your exam will give you something like this. So let's pick this one. So in your exam, you will have a question that has a story, and it has it said we have a female patient with a diagnosis of malignant neoplasm of the central portion of the left breast. And then that's what you need to go. You get that out of there. And you say, okay, this is cancer of the breast. So now you go breast cancer, and then you look for malignant, and you look for left breast, female, inner portion, or central portion. So that's how you do it. And when you get it, you go malignant neoplasm of central portion of the breast female. Let's see, 12. So what did we say? Central portion? Central portion. So now you go here, and this is what I want you to do. I want you to go like malignant neoplasm of central portion of the left breast. I want you to go to the one before. The one before says the same thing, malignant neoplasm of central portion of the right female breast. So it cannot be the right if it's the left. You know the left. So now go to the next one that is after. So we were in 112, go to 119. Malignant neoplasm of the central portion of an unspecified female breast. It's not unspecified. We know which one is. We know that it's the left. So it cannot be the one on the top. It cannot be the one on the bottom. For sure, it's this one. And that's why I want you to do it in the exam. If the exam shows you something that says like this one, malignant neoplasm of the lower inner quadrant of a right male breast, go to the one before that one. It says breast, not right or left. This has a red arrow here. It's not sufficient for Bill, so that one cannot be. Go to the next one on the bottom, malignant neoplasm of the lower inner quadrant of a left male breast. Then that is not, because we said that it was right. That's how you do this. You go to the one before, to the one after, as specific as you can get it, and that's about it. I know it's sounds a little bit complicated, but yes, no, maybe. Anyone?
Yes.
Yes.
I have a question.
Go ahead.
Is there a limit as to how many codes can be billed on one claim by CMS?
How many? Well, the thing is, you have up to 12 to put in the CMS form, if I'm not mistaken. But how many do you need depends on what are you doing.
Okay.
So if you're not do a 99-213, you don't need so many codes. Okay, but let me show you the I can get it here. So I can say let me open this real quick.
I mean, I know if it's like a sprain or something like an ankle sprain, you're not going to use like 20 different codes.
but you ask you ask like how many can you do, and I have have that specific answer. If this thing opens properly, I think it will. Opening edit. So let me share my screen real quick. So this is the CMS 1500 form. Let me know when you can actually see it.
I can see it.
Hey, that was Parker, right? You know that voice.
Yes.
Hey, Parker, what's up? You've been quiet. Okay.
No, I've been talking.
You've been talking, but no. Okay. You've been talking. My bad. So here, in block 21, we will talk about individual blocks later. In another section, we're gonna go over each one. It says diagnosis or nature of illness related to service line below. Here it says ICD indicator. You're gonna put there 0. That means that we're doing the that came out really ugly. That we're using the ICD-10. So before it was a 9, now we put a 0 for 10. And then you're gonna have A, B. So if you see, you have 3, 3, 6, 9, 12. So up to 12. Okay. Up to 12.
Got it.
ICD code spaces. But I said those codes have to match whatever we put here. So if I put a CPT here, and let me see if I can do it. Gonna look kind of weird, but CPT is 99203. Okay. And then I'm going to, in this section here, I'm gonna put what is called a diagnosis pointer. So here I'm gonna say, well, the 99203 is for the diagnosis A and B. Okay. And then I have another one here, 10012. That is going to be for diagnosis C and D. So So if you do 2, that's what you could do. Then you will need 6 CPT codes, 6 CPT codes, and then 2 codes per one. So one code cannot have more than 2 diagnoses.
Oh, okay. Okay.
So you cannot say, well, I have 20 diagnoses, 1 code. Because
Got it.
it's not possible. It's not allowed. But that's why if I have a 99 03 04 05, then I have to make sure that is accompanied by other procedures. So I can put other diagnoses there. So the answer, the long-winded answer to your question is 12.
Okay. Thank you.
If it's a hospital, forget about it. It's a different form, and you could you can actually add pages to it if you need it. Let's see if I can see it real quick. So this one's gonna look a little bit different.